7 minutes past the hour. Welcome back. Curious Kenyans asking lots of questions to Dr. Willis Akhwala. He's the chairman of the COVID-19 Advisory Task Force. Doctor, real quick, why the AstraZeneca vaccine? Why not Pfizer-BioNTech? Why not all the others out there? Why that one?
First, let me start by saying that the advisory group that looks at vaccines within the ministry recommended that any vaccine we adopt must have a stringent regulatory authority approval as one criteria and must be registered by the Pharmacy and Poisons Board. Stringent regulatory authority here refers to authorities like WHO, the US FDA, Swissmedic, the British MHA. These are considered stringent regulatory. So within the COVAX mechanism, where the doses we are procuring come from, it is a requirement that they must have WHO approval. Currently, only 3 vaccines have achieved that. Pfizer was the first one, Moderna, and AstraZeneca actually just got that about 3 weeks ago, but as an interim approval. So one of the things that was considered is the variant that is predominant in Kenya. Currently, the variant that is predominant here, the vaccine was actually tested here. You know, Kenya was one of the sites that it was tested, and it was found to be effective. In South Africa, the variant is different. The predominant variant is different. So AstraZeneca meets the requirements to be used in Kenya. We can as well also bring in Pfizer, but you know it requires certain capacities, low degree refrigeration, which we must prepare in case. But what I also really want to emphasize, we have not decided that it's only AstraZeneca. Any of the vaccines within the COVAX mechanism that will be approved, the country will be at liberty to choose any one of them at any particular time.
There's been this concern that even though we get the vaccine, we need to vaccinate enough of the population for it to do its work. And this kind of ties to the next question from Twitter. The question on the second phase coming to Kenya has not really been clearly answered. I remember you mentioned this earlier. If it will take 3 months to vaccinate essential service providers, does it mean we ordinary Kenyans will get it in September, or how fast will that process be?
So let me start by actually saying currently it's not that we are that slow. The vaccine doses available globally are so limited. So that is why countries have been given allocations staggered over a period of time. It's also good to mention at the moment the private sector cannot even access the vaccines. So no private sector can buy and sell these vaccines. The COVAX mechanism, the Africa CDC have placed orders maybe for the next 6 months, and yet these are limited. Right. But in Kenya, as the vaccines get registered and more vaccines get available, these phases are going to start running concurrently. Kenya also has a mechanism where it can procure directly using its own resources. So we are foreseeing a situation, especially from May, June, when more vaccine, Johnson & Johnson, for example, has just been registered. A lot of it is being manufactured in South Africa. So as they become more available, we are going to try and reach as many Kenyans as we can.
So when do you see a good amount of Kenyans being vaccinated? By what time do you see that happening?
Yeah, that is a little bit of a difficult, but based on resources, what I can see, especially as we go towards the 3rd quarter of this year, a good proportion of Kenyans should have already started getting vaccinated. And again, one of the things you need to realize that, again, these vaccines have not been approved for children below 18 years. So it's 18 years and above. So when we are looking at the population, you also need to consider that. However, in the coming months and years, we could start getting approval for children. So in our plan, we've included all those ages so that we work towards them. But the adult population, a good proportion of it will start getting vaccinated during the...
This is a question I asked you before the break, Dr. Arias. Leon Lujigu was asking if it costs one about 8,000 shillings to get a COVID test today. Post phase 1, you say the cost could be around 200 shillings, plus minus. Does that make sense, 8,200?
Now, let me first say that this vaccination is a public health good. The government is paying for it. Partners are supporting so that everybody can access. and the services. And as I said, phase 1 is no charge to anybody. In phase 2, in all public health facilities, there will be no charge. The question we are discussing with the private sector is we use some of their facilities as vaccination posts. And they raise the issue that they have to refrigerate and they have to use a bit of consumables. So a small administrative, this has not been agreed. We will still have to discuss. However, encouraging some private facilities have told us they can still continue administering it for free. Some.
Doctor, have you heard that, we've heard that some people say they've already been vaccinated here? Locally, people are saying
Kenyan
this.
soil.
Yeah.
Yes, I know some of the embassies in Nairobi have brought in vaccines and vaccinated their staff. I also know of Kenyans who may have been vaccinated and they came. But if there is any Kenyan who has been resident here since December up to now, and the emergency has been vaccinated, that is fake. That vaccine is not recognized, because currently the vaccine is not even authorized to be marketed by anybody. So such people should immediately seek redress and report this matter to the security
and get their money back.
Well, certainly is a process, and I know there's concern about the global north, global south, many of the advanced developed countries taking up much of the vaccine. How is Kenya protecting the interests of Kenyans to ensure that we do get enough to inoculate the population? Yeah, so it's for that reason Kenya joins the COVAX mechanism. It is for the reason we are in negotiation with the African CDC so that it's another avenue. And we are also talking to the other manufacturers who are now producing some of the vaccines that are also being used in other countries. So we are proactive so that in the coming few weeks and months, we have a diversity of vaccines.
Bottom line, here's another question. Ryan Ochieng says, will the COVID-19 vaccination be available in private health institutions? And if yes, what are the safety precautions put in place so that the public doesn't get charged more money by private hospitals for vaccination? I think you answered that a little bit.
I did answer that. And let me say, even in the normal vaccination, if a private institution does not comply with the requirements, then it is usually removed from the list and it will not receive vaccines again.
Okay.
Lots of questions coming in, Dr.
So many.
Another one here saying, what becomes of the downtrodden members of society, street families, as regards to the COVID-19 vaccine? Have you also considered them?
We've considered them. And let me say, yes, it is just a matter that vaccines are limited. But I'm happy that a number of partners are coming and talking to us as a task force and saying they want to sponsor and support certain segments, like the street children, like the refugees. And we really are prioritizing this. If we can get any support, we will want to vaccinate them as soon as we can.
Nyantika Chester is asking, what becomes of the... Oh, we've got that already, right? Street children, yeah. Okay, do you have another one?
There's another one coming in.
All right, no problem. Thick and fast, they're coming in. Sly Zuhura, what's the safety of this vaccine in pregnancy? What precautions should expectant mothers take before, after vaccination, doctor?
No, it will not be administered in pregnancy. It's not been licensed to be used in pregnancy.
Straight answer right there.
Indeed.
So many questions.
Quite a few coming in.
Just to sum things up, right? Wednesday morning or late Tuesday, the vaccine arrives.
Wednesday morning, if flight schedule doesn't change, we should have it a few minutes past midnight. And
administration begins?
The administration, we expect to begin between 2 to 3 days. Wednesday, we want to start the distribution, and a county like Nairobi, either Thursday or Friday, we should get the very first frontline health workers having their vaccination and being protected from severe disease of COVID and death.
Including yourself, doctor?
Yes, I'll be there on the queue.
He is the frontliner.
He is indeed,
yes.
Mr. Chairman.
Thank you so much for your time and your insights, Dr.
Absolutely. Okay, thank you so much. Appreciate that.